Medicare's annual enrollment period is almost here. You know, that time when millions of Americans will make important decisions about their health care coverage for next year. So whether you're enrolling in Medicare for the first time or looking to change your coverage during the annual enrollment period, Ben Keel from UnitedHealthcare is here to help you get to know Medicare. We're calling it Medicare 101 this morning. Welcome, Ben.
Thanks for having me, Micah.
Yeah, thanks for joining us. Let's get right into this. When can people enroll in a Medicare plan?
Yeah, a great place to start. So most people know, or I think it's most commonly known, that 65 is sort of the magic age at which people can enroll for Medicare for the first time. But what they may not know is you have a 7-month window to do that. You've got the 3 months before your birthday month, you've got the month of your birthday, and then you've got 3 months after your birthday. Now, again, pro tip here, don't procrastinate on this decision. You want to do it earlier in that 7-month period because you don't want to have any gaps in coverage and you don't want to incur any late penalty fees. So for sure, do it earlier in that 7th-month period. The other sort of well-known period is coming up here shortly. It's the annual enrollment period, like you mentioned. It runs from October 15th through December 7th. And that's for people that already have a plan, but it's a great time of year just to revisit your choice, make sure that plan's working for you. And then finally, maybe the lesser known one of the two is you may have a qualifying life event which lets you make changes to your plan as well. The best example that I like to give is if you move. So those are the 3 basic times where people can change or enroll in Medicare.
So when we're pre-planning, what are the most important things to consider when enrolling in a Medicare plan?
Yeah, there's a lot of things that you can consider. And the good news is, you know, there's not a one plan. It's not a one size fits all sort of space. There's lots of options for people. But at the end of the day, and as I've talked to our members, I think there's 3 main things that people should really focus on as they're making a decision. One is the budget implications of their choice, right? Most people look at the premium, how much you pay every month for your plan. But what they don't maybe spend as much time looking at is the cost of using the plan, right? So how much are those co-pays, the co-insurance, the deductibles? Both the premium and those costs are just equally as important to consider. So think about both sides of that equation. The second thing that I always encourage people to think about is the network. Most people like to see and stay on the doctors that they're seeing already. And so making sure that your doctors are part of that health plan's network is also really, really important. And then third is prescription drug coverage. So if you've got drugs that you're taking, make sure those specific drugs are on the formulary or the approved drug list. Now, again, another thing that I've learned over the years is formularies can change. And so even if you're on a plan, always a good idea to make sure you look up those drugs, look at if there's any changes the following year so you don't have surprises. People like birthday surprises, but they don't like healthcare surprises. So make sure you check.
Definitely. Are those kind of like the different parts of Medicare then when it comes to Part 1, Part B?
You got A, B, C, D. You just want to kind of do the alphabet as you think about Medicare. But let me try to explain the different parts. So there are A, B, C, and D. A and B, start there. So that's original Medicare. That's the government-run Medicare program. And so Part A covers inpatient care, hospice care, skilled nursing care. Part B is more for the day-to-day health care. So your trip to your primary care doctor, outpatient services, preventative care, things like that. So that's A and B, and that's original Medicare. Part C is also known as Medicare Advantage, so a very popular plan. That takes Part A and Part B, puts it into one plan, but it's offered through a private health insurance company, so not the government. What you get with the Medicare Advantage plan are things that aren't covered by original Medicare, things like prescription drugs, dental coverage, vision coverage, even gym coverage. My mom loves to go to the gym, so she can go for free. So that's all part of potentially Medicare Advantage plans. And then finally, Part D is probably the easiest one for people to remember. D stands for drugs. So that is a standalone prescription drug plan.
I know you've broken it down for us this morning, and we could go on and on throughout for more than the 4 minutes we have with you. But in that quick minute we have left, can you just kind of go with what the difference really is between original Medicare and the Medicare Advantage?
Yeah, so Medicare Advantage has become very popular. In fact, almost a third of all Medicare beneficiaries are now in a Medicare Advantage plan. As I said earlier, Medicare Advantage covers things original Medicare doesn't: prescription drugs, dental, vision, transportation, things of that nature. So that's one of the big benefits. The other benefit that you get with Medicare Advantage is that there's something called an out-of-pocket maximum. That is the maximum amount of money that you will spend in a year, and you know that coming into the year. With original Medicare, there is no limit. And so depending on your year, that could be a low number or that could be a high number, but you just don't know. So Medicare Advantage gives you a little bit more peace of mind along with it.
What's the website for more information in case our viewers want more information about all of these options?
Yeah, a great place I always like to start with people is a website called gettoknowmedicare.com. Again, that's gettoknowmedicare.com. There people can find webinars, they can find local agents, they can find a lot of videos and organizers just to help them understand Medicare more in plain English. So great place to start, gettoknowmedicare.com.
All right, Vin, you're going to be a busy man the next couple months, so we appreciate your time taking it out for us this morning to let us know more about these options. Thank you.
Thanks for having me.
All right, October 15th, we'll be here before you know it. For more information, like Ben mentioned, just head to that website right there on your screen, gettoknowmedicare.com. UnitedHealthcare, proud sponsor of Las Vegas Morning Blend.